Thank you so much for coming in today. It's a really interesting topic. I've really enjoyed doing my research on this. Now, you do a lot of work in something called congenital cardiac imaging,
yes.
Which for a lot of people, they will have no idea what this is, because it is a very complicated and layered area of healthcare. Could you try to explain to us in very simple terms? I know you've probably studied this for years and there's so much information flying around, but in very simple terms for people who perhaps don't know what this is.
Okay, thank you so much. Thank you for having me here. I would like to start from the beginning so that people can get a picture about what it is. I did my first fellowship in pediatrics, second in peds cardiology, and then my third one in peds cardiac imaging from Malaysia, IGN. So when you are a pediatric cardiology, although people think, what is pediatric cardiology? That's the biggest thing.
Yeah.
It's basically those children who are born with heart defects.
Okay.
It can be congenital, it can be acquired late, and it can be anything. It can be a hole in the heart, or one of the valves can be stenotic, or the heart has, the vessels are not in the normal places.
Okay.
So it's a very vast, and when I talk to a adult cardiologist, they never can get their head around it.
Yeah.
What is this? Because it's not one thing. It's not only one hole. It's so many things and so variant. And for everything, there's a different treatment option.
Of course, yeah.
So, so when I was doing this, actually Pakistan, they have a lot of pediatric cardiologists at the moment. There are around over 70 throughout the country, but our population, as you know, it's very vast.
Yeah.
So now we are in the phase when we are developing peds cardiology subspecialties. Subspecialties, intervention is one of them.
Yeah.
Imaging, electrophysiology means the ECG and the current issues. Then there's heart failure, transplant, pulmonary hypertension. There are so many.
Yeah.
So the thing is now, when I was going through it, there are so many interventionists here. Even if they don't do, and if they are not like specialized in it, they go and just, even I do it. I do interventions. I do devices and stuff. So I thought about doing something that is quite in the niche, or you can say in the very early phases in Pakistan, and it needs to be developed. And all over the world now, imaging is a very big part of not even peds, but also adult imaging.
So we're seeing a little bit on screen behind us. So the specialism you're talking about is actually being able to picture the heart,
yes,
capture what's going on, and use that as a blueprint to then come up with a plan to heal or manage the defect.
Yeah, because peds cardiology is not one person. It's a team of people.
Yeah.
It has interventionist, surgeon, ICU specialist, imaging specialist. And what puts them all glued and all together is the imaging one. Okay?
That's their map.
Yeah, exactly. Yeah. If you start with the echo, a basic echo, if you cannot show the images, how will the surgeon or the interventionist know where to go?
Of course.
And now the thing is, we have to develop these complex cardiac surgeries now, because that is the biggest problem we are having. There are so many patients. Every year we are having 30 to 50,000 patients with congenital cardiac problems. Out of that, 3 to 4% are with complex, and they have no options.
And is that in adults or is that in children?
Children.
So,
but they are becoming adults now.
Oh, of course.
That is another specialty, adult congenital heart disease. Because previously there were not surgical options, medical options, or intervention options, so majority of them died. But now more than 90% are reaching adulthood. And now they are becoming another group of adult congenital heart disease.
Through the advances in technology. So this kind of imaging and the setup that you mentioned there with the specialists and the ICU specialists and the imaging, that exists for adults, but it doesn't exist for children in Pakistan?
It exists for adults, but in children, they are in the developing phase.
Okay.
ICU intensivists are very few. Imaging specialists are very few. Interventionists, almost everyone is doing, but they are not doing complex. They are doing the basics.
Okay.
Even the surgeries, and majority of the centers in Pakistan are at RAT score 3. Although all over the world it's at RAT score 5. It means you're doing complex, but we are not doing complex because we do not have a good imaging specialist. Because when you are doing a complex, you need a very good imaging specialist to give a road plan for the surgeon or the interventionist, where to go, how to go about it.
Yeah, so you mentioned that you went to Malaysia and that's where you studied. And did you study this imaging in children specifically? Is that what you want to now bring back to Pakistan?
Exactly. I studied only in pediatrics. It consisted of echo, T in which a camera is put.
Yeah.
Surgery, post-surgical, all the cases where T was done. Then there's a CT which you can see on the back, and there was CMR for adult congenital because
Yeah.
all the because the echo images are not that good in adults, so we go for CMR. That all the guidelines are on CMRs. So that gives you, that also helps you when to intervene, when to go forward. So all these things, even after all these things, the surgeons and the interventionists are clueless.
Of course, yeah.
So what you do, you go for new specialties. Then there's mimics, VR. VR means virtual reality, just like a video game. Just like the video game, you can
Yeah.
see the heart.
Yeah.
Put the image of the CT image inside there. Get a 3D dimension, a surgeon and the imaging specialist.
A bit like this.
A bit like this, but
Yeah.
much more like VR.
Okay.
And then you can see where to put the patch.
I
And you can
see.
show the surgeon also.
Yeah.
But that is for complex surgeries. And unfortunately, even I have so many patients, I want to give them surgical option, but due to monetary issues and everything, and we do not have those surgeries very,
Widely
you can
available.
say,
Yeah.
available. Especially even when I'm sending one patient to IG in Malaysia for a simple wrist daily, I don't think it's that complex. It's costing around 60 lakhs Pakistani rupees.
So it's a really expensive thing. It's a big
Exactly.
strain on the
so
healthcare.
everyone cannot.
And most people won't be able to afford that either. It's a huge amount of money.
So what you do, then you put them in the single ventricle pathway, which is unfortunate for the child.
And what
because
does that mean?
It means the heart has 4 chambers. So basically, when we are normally, there are 2 ventricles, 2 chambers that are working. But in these children, unfortunately, if you cannot get them 2 ventricles working, then you have to go for 1 single ventricle pathway. So, but unfortunately, that decreases the life.
And it decreases the quality of life and
Exactly.
the life expectancy.
And there are so many complications.
So you're now in a position where you are fully trained, is that correct? And have the equipment to carry this kind of imaging out. So what's the next step? Are you now ready to introduce that into clinics and surgeries across Pakistan?
Yeah, I think so. Even in eco, I am making changes. I've introduced more imaging that was not that much prevalent before here, because there's a guideline that mostly people are not aware of, and they are not following it also. So I have introduced this, that the eco has to be the best.
Yeah.
If it's not showing it, then you have to go for CT.
Sort of setting new standards in the industry.
Exactly.
Yeah.
And then you have to have a clear guideline what you want to see. It cannot be, I cannot see anything, just go for CT.
Okay.
No, why? You have, everyone is doing an echo and everything. You have to see what's the problem.
Yeah.
And then you have to show it to the surgeon or the interventionist. This is the problem. This needs to be taken care of. What options can we go to the parents?
So are you now in a position where this can become something that is widely available? Are you kind of ready to go? Because it sounds like, from what you said, there are 70 specialists across the country, but it's with the skills that you have perhaps more limited.
Yes, it's very limited. There are very few people in Pakistan, hardly 1 or 2, who are completely specialized. People have gone abroad and they have done 1 or 2 months of attachment and then tried to bring it back. But a full 1-year fellowship attachment, nobody has done.
Yeah.
And the thing is, the problem is not only that. The thing is how to get people to realize the problem. To come up with the numbers.
Sort of detection.
Exactly.
Yeah.
So that's the problem. And peds always take some back seat to the adult.